So now let's see about different phases of fracture healing. Phases of fracture healing. So if you ask a physiology PhD or a student, they'll tell you there are three stages. If you remember, those are the inflammatory stage, the reparative stage, and the inflammatory stage, the reparative stage, and the remodeling stage. But the good thing for us radiologists is you need not remember any of these things. For fracture healing, you just need to remember just one point. And the point is, whenever there is a fracture, there will be a formation of something known as granulation tissue. And this granulation tissue usually forms around 7 to 14 days. That is around the second week. That is in the second week. So this granulation tissue, the importance of this granulation tissue is this granulation tissue is more radiolucent than the surrounding bone. This granulation tissue is more radiolucent than the surrounding bone. So, in another words, we can say a healing fracture will be more radiolucent in 7 to 14 days. Okay. So, this is why many times we see radiologists giving in their reports. If they have to look for fractures, if they don't see any fracture, they'll mention in the report as a disclaimer below, you'll see them mentioning as consider repeat in 7 to 10 days or 7 to 14 days. They'll mention as a disclaimer. So this is the reason. The logic is that at the time of inspecting the X-ray film, you might not see any fracture. Okay. But after 7 to 10 days, because the granulation tissue forms and because it is more radiolucent, you will you might see a fracture that you have missed before. So to be on the safe side, it's always better to give this disclaimer at the end. It's always better to be on the safe side. Okay. So now let's see. Okay, how do I move this from Zoom? 1 second. Yeah. Okay. So now let's see the rate of fracture healing. The rate of fracture healing is not the same. Different bones in the body have different rate of fracture healing. So which is the bone that heals the fastest? The bone that heals the fastest, which the fastest healing, then slowest healing. So the fastest healing bone is a small bone. Any guesses? Yeah, it is the phalanges. And it takes around 3 weeks. And the slowest healing is the long bone, and it is the tibia. And it takes almost more than 3 times of the time taken for a phalanges to heal. It's around 10 weeks. And rest of the bones, they come in between. around 6 to 8 weeks. So the fastest healing is the phalanges, slowest healing is the tibia. And after tibia, the next slowest is after tibia, the next slowest is another long bone above it. Yeah, that is the femur. Usually the neck of femur and the lateral aspect. We'll come to that later. And there is a reason why different bones heal at different rate. That also will come to we'll talk about that after some time. Okay. So and for a for a bone to heal, it requires three things. It requires three things. One is it requires good blood supply and nutrition, and there should be stability. These are the three prerequisites for a bone to heal properly. Okay, just remember this. Okay, so so if the bone does not heal properly, there are few things that you need to know. It comes under abnormal healing. Okay, and abnormal healing, you have to just remember three things. There are three abnormal healing. Three things. One is three terminologies that you need to remember. Okay, in abnormal healing. One is the bone heals very slowly. Okay, it's taking a lot of time. That is, that is known as delayed union. Then the next one is not malunion, delayed union. Then there is non-union. Then there is malunion. So in delayed union, there is the the bone, the fracture heals, but it takes a lot of time, or it takes more time than is expected. That is known as delayed union. Okay, more time than expected. It takes more time than expected. And in non-union, the bone does not heal at all without any intervention. Okay, so even after 6 to 9 months, the bones don't join, or the bones don't, the fracture does not heal. Then in malunion, the bone heals, but in an abnormal anatomical position. It will, for example, it might be crooked, just like our politicians. Okay, so these are the three terminologies that you'll encounter when you are talking about abnormal healing. Okay, and now let's see why this abnormal healing happens. What is the reason for this abnormal healing? Or, in another words, what are the risk factors? What are the risk factors for abnormal healing? Okay, there's risk factors for abnormal healing. It's it's something to do with nutrients. So what are the nutrients required? You can remember it like that. What are the nutrients required for healing of the bone? It's dependent on that. One is vitamin D. Vitamin D deficiency is the most common reason for delayed union or non-union. We are talking only about delayed union and non-union. Okay. So the risk factor one is vitamin D because vitamin D deficiency vitamin D is very important for calcium metabolism. So in that respect, if there is vitamin D deficiency, it affects the reunion of the fractured fragments. Okay, and this is the most common cause. And the next one is something to do with calcium. So here there is less amount of calcium in the blood. So any condition or disease or condition that causes reduced absorption of calcium. So that is a gastric bypass. After a gastric bypass, what happens is after gastric bypass, there is reduced calcium absorption from the stomach. And because of this, what happens? It will cause secondary hyperparathyroidism. Secondary hyperparathyroidism. Okay. So as you know, hyperparathyroid, the function of parathyroid is to take calcium from the bone to the blood. Okay. It increases the calcium in the blood, but it strips the calcium from the bone. Okay. So because it strips calcium from the bone, it will strip calcium from the bone. All the calcium is removed from the bone. Okay, this is the bone. And all the calcium is removed from the bone. And there was a fracture here. Okay. So since all the calcium is removed from the bone, this will affect the healing of the bone. Okay. And the last one, the drugs, the usual with the usual things. That is, one is steroids, prednisone. Number two is NSAIDs, and the usual culprit in everything, tobacco, smoking, and chewing. Okay.